Hi, this is Ellie Fishman, and welcome to December 2018 quiz. I can't believe it's December. What happened to January, February, March, April, May, June, July, August, September, October, November? We're now in December, but we have 10 cases to end the year, and let's get started. In this case, I asked you for the best diagnosis. You see a 3D volume rendered image, and you see a cinematic rendering. This is a great case. What you see is a dilated right renal pelvis. You're trying to figure out why. Then you see that the patient has two right renal arteries, and the lower pole renal arteries are crossing vessel right at the UPJ obstruction. There's a classic UPJ obstruction. You can have UPJ obstructions for a number of reasons, but one of the ones that's easily fixable is crossing vessel. Once in a while it's the vein, but more commonly it's a renal artery, usually multiple renal arteries critically located, as in this one, beautifully shown with volume rendering and with cinematic rendering. In this patient evaluated for aortic aneurysm, what's the incidental finding? So we do make the point that there are incidental findings in every organ. And often aortic aneurysm patients are older, so you better look carefully. All of the things I've listed could be incidental findings, but look at the bladder. At about 3 o'clock, there's an enhancing lesion, classic for an incidental bladder cancer. In our lectures and in other places in CTisus, we do make the point that you need to look carefully at the bladder. It's very easy to pick up a small bladder cancer in a bladder that's distended because we give 1,000 cc's of water in these patients. Beautiful example of an incidental bladder cancer measuring less than a centimeter. What's the best diagnosis in this case? Well, it's a beautiful example of a mass in the mesentery, and then you could say lymphoma or carcinoid. But you see the desmoplastic reaction, the finger-like projections, the encasement of SMV and SMA. You see that actually on the image on your left, there's a mass in the small bowel, which is vascular. Look at the size of those vessels, all due to that desmoplastic reaction. This is a classic example of a carcinoid tumor, and in this case, we see both the mesenteric mass with desmoplastic reaction, as well as the tumor in the patient's ileum. The least likely diagnosis in the evaluation of the descending colon in this patient is, well, beautiful cinematic rendering. Look how the mucosa has hyperenhancement. You don't see diverticular disease present. This could be ischemic, it could be UC, it could be infectious. It was, in fact, ulcerative colitis. But the one thing this is not is diverticulitis, because there are no diverticuli being visualized. So just a beautiful example. Also a cinematic rendering accentuating mucosa from submucosa. Just a very nice example of inflammatory disease in the bowel, which is the only sure diagnosis, but this was ulcerative colitis. Best diagnosis in this case, showing you a very nice image, sagittal view, volume rendering, and cinematic rendering. You see a well-defined mass, exophytic in location, beautiful visualization on the cinematic of the gastric folds. This is one of the classic tumors. It's an exophytic lesion off the stomach. That's a GIST tumor. There's no second guess. There's no second choice. Beautiful example. In this case, I asked you for the best diagnosis. If you look at the pancreas, you see multiple vascular pancreatic lesions, which are better seen on the MIP imaging. And you could say this is multiple neuroendocrine tumors, but then when you look at the MIP, you see the patient has a normal left kidney, but there's no right kidney. Vascular pancreatic mass, missing a kidney that's been resected, regardless of how long ago, that's going to be metastatic renal cell carcinoma to the pancreas. So just a very, very nice example. Again, something to remember. The most likely cause for collateral flow in the abdominal wall is, wow, look at those varices, particularly on the right side, because the patient had a right-sided injection. Incredibly impressive varices. Now, they go all the way up to the axilla, so it's not going to be IVC occlusion. It's not a pattern of congestive failure or chronic liver disease. When you see varices like this, it means something obstructed, usually the SVC, and it's a beautiful example of collaterals. I also like it on the cinematic, how nicely you can get that 3D feel of those collateral vessels. This patient had IV drug abuse, had right groin pain, best diagnosis. Beautiful example of a pseudoaneurysm, femoral artery. What else could it be? It could be a mycotic aneurysm, but the likelihood is vascular or related to IV drug abuse. So a very, very nice example. We do see these not uncommonly. Look carefully. You see in this case, femoral arteries narrowed. Sometimes you look carefully, you can see broken needle fragments. So just an important case in this day and age. Most likely diagnosis in this case, well, I see multiple liver mets, I see multiple splenic mets, and you see a low-density lesion tail of pancreas. That's going to be a tumor. Could be an adenocarcinoma, I guess, but at the end of the day, it was vascular and was a neuroendocrine tumor. Neuroendocrine tumors can be differentiated on CT, and we are looking now, can you look at neuroendocrine tumors and determine how aggressive they are based on some of those maps? So it is an important diagnosis. In this case, patient with gastric cancer, what's the key finding? Well, I guess the key finding is related to staging. There are some nodes present, that's true. I don't see a liver met, I don't see a bone met, but look at the omentum. You can see this nodularity, that infiltration of tumor onto the omentum. That's classic carcinomatosis, and just a very nice example. You see in this case that the patient's primary tumor is infiltrating, but again, the more aggressive a tumor is, the more likely you'll get metastasis. And in this case, we have a very nice example of a gastric cancer with omental implants. Well, that's 10 cases. I guess we can just pop open the champagne. Maybe it's a bit early, but it's never too early for good champagne. With that, we'll see you next year. Bye.
All right. That was super quick.
Okay. There, let's
Can we save this? And then
save this. Let's do the spleen later. My
we
voice.
can do it sometime next week.
Okay, well, let's try.
Yeah.
Let's try aim to 2. Let's try a little bit later.
I'll probably run out at some point to the printer to
Okay,
get
well,
the last of it,
whatever.
but I'll come back and
We'll try.
yeah.
Do the end of the day. Even if I do one of them.
Yeah, sounds good.